Welcome to our Action Research Project Summary for EDOD677, Fall 2014, Addressing Retention at HealthPoint. First of all, we'd like to welcome you to our project proposal and summary and introduce you to our team. Our team members are Rebecca Glasgow, Leslie Hansen, Libby Johnson, Cheryl Marchetti, and Anthony Morgado.
Our proposal involves a healthcare provider. We refer to them as HealthPoint. At HealthPoint, 30% of the regions are suffering from a severe retention problem. A lot of new hires are saying, "I quit." And there's a pattern. New hires seem to be quitting within the first 12 months of being hired.
As the action research process evolved, we came down to two key questions: why new hires are resigning from HealthPoint, and what can be done to improve new hire retention rates. So why is this important to HealthPoint's leadership? According to Garion and Connor, improving employee retention in healthcare organization likely means lower operating costs, higher productivity, and more importantly, improved patient care. Our first thought was to look at the new hire onboarding process. The research and literature review process expanded our thinking and guided our research methodology. The literature review process revealed that onboarding is a long-term socialization and learning process and expanded us to a broader set of topics in our data gathering process. We needed to look beyond the basic onboarding experience and examine HealthPoint's development planning processes. What are employee-manager relationships like? What is the difference between novice and experienced new hires? What about support and mentoring programs at HealthPoint? Stringer says, in the early stages of action research, gather qualitative data to expose the day-to-day reality of the participants. And we were going to focus on one-on-one interviews to get that information. Stringer also points out that quantitative data has limited utility in the early stages of action research. In the later stages, it can broaden participation and data check earlier qualitative results. And that's exactly how we plan on using it. In order to support rigor in our research methods, we're going to use multiple data gathering methods. This includes interviews, observations of new hires interacting with their managers, reviewing organizational records such as offer letters, employee orientation materials, and look at existing exit survey data from employees who have recently left the company. And finally, as Stringer advises, we'll use surveys to broaden the range of participants in the process and to check whether information acquired from participants in the first cycles of the process is relevant to other individuals and groups. Our key human resources for this project include 5 OD staff members to help facilitate the action research process, involving 210 employees through the data gathering process, and finally a core team of 10 staff members to participate in our action research team. And that's a summary of our original proposal. But things have changed at HealthPoint. There is no budget or resources for one-on-one interviews. We let Anderson advise that in many cases, interviews can be the only choice in getting at specific issues, such as employees' experience with a manager or in a small group, guide our focus on conducting interviews. At first, we thought the inability to interview threatened our ability to get at the specific issues that Anderson refers to, because we would not have the opportunity to speak directly with those closest to the retention issue and share their day-to-day reality. First of all, we have to recognize that action research is an adaptive process. As the environment shifts, we may have to shift our thinking. In essence, we have to evolve the process as the environment adjusts. As a group, we discussed the limitation of no longer being able to do any one-on-one interviews. We identified pros and cons and came to the conclusion that we can embrace this change and move forward with our action research project. By eliminating 210 individual interviews, we anticipate increased stakeholder buy-in. Implementation time could be shortened. There'll be less disruption to participant productivity, and employees can maintain their focus on enhancing the quality of patient care. There is concern that eliminating the one-on-one interviews could result in a limited number of individual employee perspectives being collected, as well as the possibility of less detailed information about those specific experiences. We are confident we can redesign the data gathering and address the research questions and maintain the integrity of the Action Research Project. Though we can no longer do one-on-one interviews, we still plan to keep our primary data gathering methods intact, and those include observations, examining organizational records, exit surveys, and a survey of participants, though we will make some modifications to the survey we'll discuss in a moment. We also want to keep our original perspective on the researcher's role. As Stringer says, the researcher acts as a resource, as a guide, a facilitator, to assist stakeholders on the journey to define the problem and discover resolutions. In our redesign, we'll use focus groups as a method for qualitative inquiry. This will provide an opportunity for employees to share their day-to-day realities and experiences. This will allow us to collect our qualitative data in an efficient, less resource-intensive, meaningful, and participatory manner. We will conduct 5 focus group sessions with 10 to 12 participants by session, and participants will be organized by role in the focus group sessions. Stringer advises that, like interview questions, focus group questions should employ neutral language and maximize the opportunities for participants to express themselves. We will follow some of Stringer's ground rules in the design of our focus groups. An OD staff member will facilitate and an AR team member will record. They'll capture the notes in participants' own words, and at the end will identify common themes and prioritize messages from the focus group. Professor Russell Court of Colorado State University identifies orientation as a socialization and learning process that ultimately, if done well, impacts retention. Anderson indicates, like interviews, focus groups allow the exploration of experiences and situations in depth and the ability to follow up on specific areas of interest. Using focus groups will allow us to gather firsthand the day-to-day reality of our participants. And at the same time, there's a synergy because we'll be using a social data gathering process to examine the social process of new hire orientation. As part of our redesign, we will follow Stringer's model in regard to using surveys. We'll look at it as an opportunity to broaden the participation in the process and send the survey to all 210 employees impacted by the new hire process in the past year. The survey will consist of both qualitative and quantitative questions and be looked at as an opportunity to qualify, nullify, or confirm the qualitative data collected through the focus group process. In the redesigned proposal, by incorporating focus groups and expanded survey data, we'll use less resources to gather data, and we believe we can still get the full story of the participants in the new hire process at HealthPoint. The foundation of this thinking is that we're using multiple data gathering processes in order to collect the HealthPoint story. For example, we can look at data from employee exit surveys. This gives us access to people who've left the company, and their story could help substantiate experiences identified in the focus groups and participant surveys. The employee exit surveys gather data on the employee's experience through the hiring process, orientation experience, the manager support they received, co-worker relationships, and how the work environment influenced their decision to leave the organization. Court, Kelly, and others all indicate that these are critical factors in new hire retention. Stringer indicates that the action research process provides an opportunity to unpack key experiences or events to make them more meaningful and understand their effect on our lives, and we believe our redesigned proposal supports this belief. The focus group process, in conjunction with our other data gathering methods, will provide the information to understand the new hire reality at HealthPoint and ultimately guide us to information to answer the questions why new hires are resigning and how to improve new hire retention at HealthPoint. We recognize that action research is a cyclical and adaptive process, and this could be the first of many modifications as the intervention is pursued. The bottom line is we recognize we'll have to evolve as the project and the process evolves. Stringer points out the primary purpose of action research is to provide the means for people to engage in systematic inquiry and investigation, to design an appropriate way of accomplishing a desired goal, and to evaluate its effectiveness. By keeping Stringer's advice in mind, and taking a facilitative approach to our action research project and incorporate an adaptive mindset, we can help HealthPoint make a difference in the new hire experience. Thank you.